Have you looked at your feet today? Not a quick glance from above, I mean really looked. Take off your socks, sit on the edge of the bed and observe. Because what I'm about to reveal in the next few minutes could completely change the way you think about your health. I'm Dr. Raymond Chen, I'm 71 years old, I'm a board-certified endocrinologist. I spent 40 years of my life inside hospitals in Scottsdale and Phoenix, treating diabetes, obesity, and metabolic disorders in people our age. I was the Director of the Metabolic Health Center at Banner University Medical Center, one of the largest endocrine referral centers in the Southwest. And I need to confess something to you. In 4 decades of American medicine, from Johns Hopkins to the Mayo Clinic, I never learned in medical school what my great-grandfather in Taipei knew just by looking at a person's feet for 30 seconds. In ancient Chinese medicine, the feet are the mirror of the entire body. Every spot, every mark, every change in color or texture on your feet is connected to an organ inside you. And the organ that screams the loudest through your feet is the liver. This is not superstition. The liver meridian in traditional Chinese medicine starts exactly at the big toe and runs up along the inner leg. When the liver suffers, the first place that shows signs is down there, at the farthest point from the heart, where blood arrives last and leaves first. And here is the problem that keeps me up at night. Most people see their heels cracking and buy a cream. They see their feet swelling and prop them up on a pillow. They feel itching on the sole and assume it's athlete's foot. And meanwhile, the liver is quietly rotting in silence. No pain, no fever, no clear warning. Until the day the blood test comes back with terrifying numbers and the doctor says it's already advanced. But it doesn't have to be that way. Your feet warn you years before. I'm going to show you now 7 signs your feet give when your liver is in danger. If you identify 2 or more of these signs, I'm asking you, do not ignore them. Pay very close attention to sign number 5, because it's the one most commonly confused with another disease, and almost nobody gets the diagnosis right the first time. Let's start with the 7th sign. Red and brown spots on your legs and feet. Look at your shins and the top of your feet right now. Do you see tiny reddish or brownish specks scattered across the skin? Small, almost invisible? Most people think these are age spots. But when the liver isn't working properly, it accumulates estrogen in the body. This excess estrogen damages circulation, and the result shows up on the skin, especially on the legs and feet, where blood has the hardest time reaching and returning. My great-grandfather called these the tears of the liver. He used to say that when blood weeps beneath the skin, it's because the body's main filter is suffocating. The 6th sign, varicose veins and spider veins on your feet and legs. Those bluish or purplish veins that keep appearing, especially on the calf and ankle. Again, this isn't just a cosmetic issue. It's a congested liver causing increased pressure in the veins. The blood that should flow back up to the heart gets backed up. In Chinese medicine, we say the liver governs the flow of blood. When it jams, everything jams with it. The veins dilate because they're holding a weight they were never meant to carry. The 5th sign, and this is where I need your full attention. Pain on the sole of your foot, especially when you step down in the morning. You get out of bed and feel that sharp sting in your heel or the bottom of your foot. You go to the orthopedist and he says it's plantar fasciitis. He gives you an insole, an anti-inflammatory, and sends you home. I know this because I did the same thing to hundreds of patients for years. Until I went to study my great-grandfather's journals in Taipei and found a note that sent chills down my spine. He wrote that pain on the sole of the foot, when it appears without a mechanical cause, is the scream of a congested liver. The point of the liver meridian that passes through the sole of the foot becomes inflamed when the organ is overloaded. It's not the foot that's sick. It's the liver sending a distress signal through the only pathway it knows. I'm not saying that every foot pain is a liver problem, but I am saying that if you have this pain and it doesn't go away with insoles and medication, it's absolutely worth investigating your liver before accepting a fasciitis diagnosis. It could be the difference between treating a symptom for the rest of your life and solving the root cause in weeks. The 4th sign, cracked heels that won't improve with cream. You apply moisturizer every day, wear socks at night, exfoliate regularly, and nothing works. The heels keep cracking, sometimes even bleeding. Everyone says it's dry skin, but the truth is something else. One of the liver's jobs is to produce bile. Bile helps your body absorb healthy fats, vitamin A, vitamin E, and omega-3. These are exactly the substances that keep your skin hydrated from the inside out. When the liver fails, bile decreases. Without enough bile, you can apply the most expensive cream in the world and it won't solve anything. Because the problem isn't in the skin, it's in the liver that stopped doing its job. The cream treats the surface. A healthy liver treats the root. My great-grandfather never treated a cracked heel with ointment. He treated the liver, and the heel healed on its own. If what I'm showing you makes sense, go ahead and subscribe to this channel now and leave a like. I make it my mission to bring you real science translated in a way anyone can understand. No complicated jargon, no impossible recipes. Every single week. Deal? The third sign. Itching on the soles of your feet with no apparent cause. It's not a fleet's foot. It's not an allergy. It's a persistent, irritating itch that comes and goes without explanation. In conventional medicine, this is called hepatic pruritus. It happens when the congested liver starts accumulating bile and histamines in the blood. These substances irritate the nerves in the skin, and the itching appears first on the feet and the palms of the hands, because those are the areas with the highest concentration of nerve endings. In his journals, my great-grandfather wrote something I find brilliant. He wrote that when the feet itch without a wound, the liver is trying to clean the house and throwing the trash out the wrong window. The body is trying to expel toxins through the skin because the liver can't handle filtering them through the normal pathway. The second sign. Feet that are too hot, especially at night. You lie down in bed and need to pull your feet out from under the covers because they feel like they're on fire. In Chinese medicine, this is a classic sign of excess heat in the liver. An overloaded liver generates what the Chinese call internal fire. And that fire travels downward. It goes to the extremities. Your feet burn because the liver is inflamed inside. Many people blame menopause, poor circulation, or anxiety. But if your feet are burning and you have any other sign on this list, investigate the liver. And now the first sign, and the one that scares me the most because of its severity. Swelling in the feet and ankles that leaves an indent when you press. Press your finger against your shin right now, just above the ankle. Hold it for 5 seconds and release. If a sunken mark remains that takes a while to bounce back, this is called pitting edema, and it's one of the most serious signs that the liver is not producing enough albumin. Albumin is the protein that keeps fluid inside the veins. Without it, fluid leaks into the tissues and pulls in the feet and legs due to gravity. When this happens, it's no longer an early warning sign. It's the liver begging for urgent help. Don't wait. See your doctor this week. Now, before I wrap up, I need to tell you something that might be the greatest relief you hear today. Not every sign in the feet means the liver is destroyed. Many times it's just a congested liver, an overworked liver, a tired liver. And a tired liver can recover if you act now. Here are 3 simple things you can start today. First, stop overloading the filter. Cut the hidden sugar. I'm not just talking about candy. I'm talking about white bread, crackers, boxed juice, diet and low-fat products that are loaded with chemicals your liver has to process. Big food puts poison disguised as health on the shelves, and then Big Pharma sells you the pills to treat the damage. Unpackage less, peel more. Your liver will thank you. Second, drink warm water with lemon on an empty stomach. This is something my great-grandfather did every single day of his life. He lived to 94 with a clean liver. Warm water gently wakes up the digestive system, and lemon stimulates bile production. It's simple, it's cheap, and it works. Third, move your legs. Walk at least 20 minutes a day. Blood circulation in your feet depends on movement. When you walk, blood flows back up to the heart and passes through the liver to be filtered. Staying still is letting the waste pile up. My friends, your feet carry you your entire life without complaining. The least you can do is look at them with attention when they're trying to tell you something. In Chinese medicine, there's a saying my great-grandfather repeated every day in his practice in Taipei. He used to say that whoever takes care of the roots never has to worry about the leaves. Your feet are your roots. Take care of them, listen to what they're saying, and your whole body will flourish. If this video opened your eyes to something, help me spread this information. Share it right now with your family. There are so many people rubbing cream on their heels thinking it's dry skin, when their liver is crying for help in silence. Leave a like, subscribe to the channel, and tell me in the comments where you're watching from and if you have any of these signs. I'm Dr. Raymond Chen. Take good care of your feet because they're taking care of you.